The more they call patients, the more they ask how patients are doing, the better the customer service, the better the patient feels taken care of. And as a result of that, the more you will be able to upsell, and the more you will be able to cross sell, and the more you will be able to have that patient tell somebody else about you and improve the loyalty circle and get more referrals. All right, so we've talked about why it's not super important to have a ridiculously nice clinic. If you have a decent clinic that is well presented, clean floors, clean walls, nice pieces of art, and a few simple chairs and furniture, patients don't really care. They care about the experience, the customer service. This is why customer service is such a highly important core value in Genesis and really all my companies. Customer service is what's going to make or break you. People are so used to just getting mediocre customer service nowadays that they don't really care. But if you go above and beyond, like ridiculously over deliver and give an incredible customer experience, that person is going to tell everybody about you. They're going to leave a 5-star review. They're going to help you grow like crazy. And so the first thing that we do when it comes to customer service is really knowing our patients. We introduce ourselves and call our patients by their first name. Why? Because it's more friendly. I know people are saying, oh, that's not professional. Do you know the number of patients that we've had over the past 5 years of growing Genesis that have said that's unprofessional by calling them by their first name? 2 out of now 23 different locations. People do not care about being called by their first name as long as it's in a friendly and respectful manner, period. But what that does do is open you up to being a friend to them, to being their colleague, to being their partner in their journey that they are coming to you for. Because you're not going to call your friend by their last name. Maybe you will if it's a nickname and you've known them forever, but most of your friends you're going to call by their first name. And so that's what we establish. We want to be that friend to you. We want to hold your hand and be by your side the entire time you're going through this journey. So calling people by their first name shows friendliness to us. We ask them about things that are real outside of just their health. Hey, how are your kids doing? How was the weekend? How's this week going? Whatever they talk about is usually the most important thing to them. So we talk about that more. Tell me more about that. How is this? How is that? Making sure that you're creating a real connection, a real conversation with people. And if you don't know how to have a conversation with people, go to the ACA framework video, search ACA, watch that video, and that will teach you how to have just a normal conversation. Because nowadays, where everybody's on their phones and texting and used to that, they don't have real conversations with each other anymore. So making sure you're doing that and learning how to have a conversation with somebody is really important. Look, I'm an introvert by nature. I'll be fine if I was in my garage with my cars and never leaving home at all. I actually have scheduled my life to make sure I don't leave home and speak to people. Naturally, I'm an introvert, but I've practiced and read books on how to be an extrovert, how to have conversations, how to speak to the camera, how to speak on stage. And it's extremely important that you do that because you're going to be talking to your patients all day long. And if you can have great conversations with them and they feel great after they leave your clinic or when they're visiting you, they're going to come back, they're going to spend more money. So make sure you're really friendly with that. With them actually getting into the clinic, how do we decrease our appointment no-show rate? Well, we do that by establishing a good, strong care upfront. We use the closer method. So if you don't know what the closer method is, go to the closer video and watch that. But with the closer method, what we're doing is finding out what the patient's problem is. What is the client's problem and what we can do to fix it? At least getting started with that. Do you have a problem? I want to lose 20 pounds and fit into my jeans this summer. Cool. We are going to create the Sandra's 20-pound weight loss fitting into jeans this summer package for Sandra. That is a problem that we can fix. You've labeled them with that issue. So making sure that you build some rapport up front as to why they're coming in, what their issues is, and what their pain points are to make sure that when they do come in, you're able to treat them and continue that conversation and improve on their care and their experience, again, that they haven't had at other locations. So we also provide multiple reminders. So our reminders for our patients, we get 3 text message reminders, 3 email reminders, and a phone call at the same time, either the night before or the morning of, reminding them of their appointment. People forget, people have busy schedules. Sometimes they need to reschedule, especially nowadays. That's okay. It's very important to make sure that you're consistently hammering those people with confirmation so they don't forget you, checking in with them so that they don't forget you. So that's how we've been able to decrease our appointment no-show rate. We're doing other things that we haven't yet implemented. Again, we're always learning, always improving. Even after earning tens of millions of dollars now a year, we're always trying to improve our processes, innovate things. So we're doing things such as introductory videos and introductory text messages and things people can see and get excited about, seeing before and afters of patients who have done their specific treatment that they're trying to do. So making sure we do it that way. Also, we always make sure that we reach out or respond to a patient in the way they're reaching out to us. This has been proven to decrease no-show rate. So for example, if a patient texts us, we text them back. If they email us, we email them back. If they call us, we call them back. Like for like. That has shown to decrease the no-show rate. Another thing that has been shown to decrease no-show rate, more appointment time options and more just hours open in a day. Sometimes you can't open more hours in a day. Sometimes you can't open more hours in a week. You have to be very smart about that. But at the same time, if you increase the number of booking slots available from, let's say, every hour to every 15 minutes, and there's more slots, there is a higher chance of a client being able to find the actual time specifically that works best for them, which will increase your show rate, decreasing your no-show rate. We also make sure that we have consistent follow-up strategies when these people are booking, as well as for leads that don't show up to appointments. So for example, we talked about the 3 emails, 3 text messages. Well, once they've actually gone through their consultation or they no-show, we have a specific policy, a specific standard operating procedure. Hey, this patient no-showed, communicate with the virtual assistant team. The virtual assistant team is going to put them back into our CRM, which is called DEFCON 1 Marketing, our client relations manager, to automatically text them, put them back in the no-show campaign so that we are saying, hey, we missed you, let's get you back in. The girls are automatically calling these leads, etc. So we are consistently hammering these people to get them back in. We know that we're going to have no-shows, but at the same time, we are doing whatever we can to get those people back in. At the same point, we always make sure to train our staff to overbook based on the amount of no-show rate. So if we have a no-show rate of, let's say, 50%, then they overbook by 50%, anticipating the no-show rate. This sounds scary for some clinics. Well, I can't see 50% more patients. Well, you already have an average of 50% of people not showing up. So even if you book 50% more, the chances of all 50% of those people showing up is already super low. So if you have 10 people normally and your show up rate is 50%, then that means you're going to have 5. If you book another 5, that new 5 still isn't going to show up 100%. They might have, again, 50% booking. So you might book 15 people and 7.5 people show up. I know the math is off there, but you get what I'm saying. Between 7 and 8 people will show up. But it's better than 5 people. You get 2 or 3 more chances to sell people based off of your no-show rate. So we always make sure that we double book when we have high levels of no-shows. That helps us make sure that our income is always growing or always at least stable and doesn't drop because of the increased no-show rate. We make sure we're on top of that consistently. The next thing is we make sure that we always have those standard operating procedures in place. And standard operating procedures we have talked about. We have SOPs for everything so that people experience the same thing when they come into anybody's clinic. How to smile, how to introduce yourself with a first name basis, how to shake a hand, how to discuss erectile dysfunction, weight loss, how to do a sales conversation, how the providers should upsell in the back, or the nurse practitioners or the MAs, how they should help with patients. And those are consistently always being redone, improved, rewritten. And so that every single position, every single thing that we do in the clinic has a standard operating procedures. And we make sure we implement this effectively and efficiently by having trainings. So we have what's called Genesis University, as well as Asana, two training platforms that we built out that has training on everything we do, from sales to these videos to how to do a certain procedure to how we should bring a patient back, how you check in a patient, how you dispense drugs. Everything we do, we have created videos or are creating videos consistently about, loading them onto that. So we have a huge Rolodex of all the different things a clinic does in order to be successful. We also make sure that we are priding ourselves and focusing on core values. Every week we talk about core value. Every day we're posting about some sort of core value. We're always bringing everything back to our core values over and over and over. And we implement them, have our staff remember them, and talk about them. The more we talk about our core values, the more staff understands how we should operate, how we should be delivering to the patients, and it increases our quality, our customer service, and our ability to implement new standard operating procedures, because one of our core values now is growth. It used to be always be learning, but now it's growth. And that means personal, professional, and clinic growth. So whatever we can do to improve the clinics, grow the clinics, we are doing that consistently, constantly, and our staff knows about that. So they're always on board when we implement new things. Making sure you have SOPs are extremely strong to make sure that across your clinics, multiple locations, you have the same level of customer service. Now, our follow-up strategy and how we increase patient retention. Many of our clinics call every single patient every single month. Every single patient, every single month. And those clinics do the best out of any clinic in our corporation. The clinics that call every single patient every single month are the ones that do the best. Oh my God, I have so many patients. Yeah. Guess what? If you want to keep all those patients, communicate with them. The more you communicate with them, the more touches you have with them, the more they'll trust you. The more they trust you, the more they'll spend with you and trust that you have their best interest in mind. So making sure that you're consistently calling these patients every single month, checking in with them. Hey, how you doing? How you feeling? How's your medication? Are you ready for your refill? That will get them in the system and continue to keep them in the system. As far as that goes, you also build trust much faster. And when you build that trust much faster, they will spend more money. So if they're doing this weight loss medication, they might ask, hey, what else should I be doing? Well, you should also be taking this vitamin along with it, or this probiotic. And those are things that you can sell to them to upsell the patient into other services that are, again, going to help them out and help improve their health care. So Allergan did a study, a countrywide study on Botox patients and how many times it took a Botox patient coming back to a provider in order for them to really open up their wallet and spend more than, I think it was $2,000 on a visit. And it was 3 times. Why? Because each Botox visit was only like 30 minutes in length. But if you think about it, Botox visits are 3 months apart. So 30 minutes, 3 months apart, that is 3, 6, 9 months, 30, 1 hour, an hour and a half. An hour and a half of time or 9 months in order for these people to trust you and spend more money on Botox or fillers. So we try and compress that time. Why? Because the better they trust us or the faster they trust us, the more money they'll spend with us. So we talk to them consistently, have them come back weekly for in-clinic injections of lipoline or B12. We give those things out for free in packages a lot of times because we want them to come back. We want them to be measured on our in-body or our Striku machines that test their body fat and weight. Talk to them about their struggles with weight loss or struggles with ED consistently. So we are always on top of any issues that they may have quicker. The sooner I know about an issue with a patient, the sooner I can change it. And so my clinics know that. The more that they touch patients, the more they call patients, the more they ask how patients are doing, the better the customer service, the better the patient feels taken care of. And as a result of that, the more you will be able to upsell, and the more you will be able to cross-sell, and the more you will be able to have that patient tell somebody else about you and improve the loyalty circle and get more referrals. And the last thing on that is don't sell somebody something that they don't need. This is one thing we pride ourselves on. We will push patients away if they do not qualify or should not be getting a certain procedure. And this will improve and increase your clinic revenue more than anything else out there, just doing the right thing. We had a patient, and I remember this because we were rewarded based off our core values of accountability and customer service. We rewarded this staff member because we had a patient come in she had $10,000 cash and wanted to pay for cool sculpting. Unfortunately, she wasn't the best candidate, and there were other treatments that can help her out way more than cool sculpting. Our salesperson, instead of taking that $10,000 and taking the commission, told her, "You're not a good candidate for this. I'm not going to take your money. You should think about this treatment. This is the treatment policy we should have." And that patient walked away. But that patient brought now probably over a dozen other friends that have spent tens of thousands of dollars with us because we did the right thing for that first patient and refused the sale based off the fact she wanted it and didn't actually need/qualify for it. And so she knew that our integrity, one of our core values, was extremely high. Our customer service was extremely high. And our morals were higher than our desire to just sell something and take people's money. And as a result, that really solidified in that staff and that patient's mind, hey, I am doing the right thing. They are doing the right thing. If people are disqualified for treatment, don't force treatment down their throats. If they can't afford a $10,000, $15,000, $20,000 treatment, don't force it down their throats. Do what you can do with the money they have for most of the time. There are some times where they just can't afford it, and that's okay. You're not for everyone. Again, you're a business. You have to actually grow. You have to actually get a certain amount of money in order for you to improve and expand. But don't sell somebody something that they don't need. It will just ruin your reputation of your business. So that's some of the strategies, not all of them, about how we create a really positive patient experience every time that they come in or every time that they are part of a Genesis Lifestyle Medicine or any of my companies in general. I hope that helps, and looking forward to seeing you on the next video.